So in this episode, we are going to go through the government-backed healthcare systems and see the issues in the government-backed systems. And I was in the UK recently and I visited a few of the NHS, got to know the system. I have a few really close people who also work there. And again, like this is covering the Innovator's prescription by Clayton M. Christensen. We are going over the problems with the current healthcare system. So now in the government-backed system, I think the first complaint that everybody would hear is that the waiting list for things, almost everything, is like insane. So you have like a lot of patients who are on this huge waiting list, and the waiting times can sometimes be insane, like because there is a bottleneck somehow in the process, and there is probably like one or two doctors who are actually on the other side who are able to serve these people, and the capacity of this healthcare system is real. So in a real way, they have built capacity only for a certain number of patients, and when the population grows and when you have more people, it's just not designed to take that number of people in. Whereas in a more commercial or a competitive system like the US or India, which is still, again, the US is still backed by insurance, you have this competitiveness between different players, and then they somehow, when there are more unhappy patients, prices increase and they're able to like kind of optimize for it. But since all of this is government funding, so you have one single government institution which is funding all of this, you don't have the same level of competitiveness. And again, like that's the reason for the second point here, which is it's not optimized for efficiency in any way, and it's not optimized for innovation. The amount of innovation that you see in a commercial, competitive, capitalist market, it's not comparable. You cannot compare that to a government-backed system because they design it and they do it mostly like how communist Russia used to price things, right? And there is a committee which sits and which decides what is the best thing to do. So that's always going to be slower than capitalist economies which are able to just compete, and two people are, if the prices are higher, more people open shop and the capacity and the supply and the demand is always met. So that is not usually possible in a government-backed system, and real taxpayer dollars have to be allocated and then budgeted, and it's a committee decision rather than the market deciding for itself, right? So there is intrinsically an inefficiency in doing it this way, in that there is a small committee of people sitting here who are actually discussing, and they're taking long breaks and they're taking vacations, and then they're discussing how many more doctors we need to hire or how much more we need to pay the already extremely underpaid NHS doctors, right? So again, like since you don't have this competitiveness and this sort of a capitalistic market here, innovation also kind of suffers. Like although the same procedure can probably be done for much cheaper, faster, there are no real incentives to really do that because it already works. Why should we, invest in this extra amount to actually get this going? So there is, and again, like even before that gets done, it needs to be approved by a committee, and it takes its own sweet time, right? So, and again, the other problem is that the patient in this case does not really get much of an option, and they go through the guidelines that are set by the government. And again, like I've been an advocate for having guidelines over a few intelligent doctors, but then some of the times these guidelines may not be up to date with the best practice in care, right? And they, even though for a very particular scenario or a particular patient, they know that something is wrong. For example, I heard the story about one of our relatives, I think. So they were pregnant, they were in the maternity ward, and in the maternity ward, you don't have doctors in the UK, you have midwives, and they take care of you. And then they noticed, and this the patient is actually an obstetrician. So they are a doctor themselves, they know what's going on, and they can immediately see that there was a lot of bleeding all of a sudden. The midwives did not recognize that at all, and they just said that the protocol dictates that we don't do anything. And this lady, who was a qualified obstetrician, was screaming that you had to take her into the OT and do a cesarean section as soon as possible. But then the midwives did not really understand the scenario, and they just were careless, and they didn't really know what to do. And again, like, somehow she lost a lot of blood. She, I think, fainted, and then they had to give a lot more blood, and then finally somehow it came out and they survived the whole fiasco. The baby was also fine, but then for her second delivery she flew back to India to get delivered. So you can see how although guidelines are good in some sense, if not done properly, if not implemented properly, and you have this blanket guideline which you are just, and you don't have skilled enough people to actually perceive what needs to be done, then you are in big trouble. And again, like, that's the whole, you need to have enough qualified doctors, you need to have enough trained people, and when the system itself does not have the capacity for that, and the funding comes from a committee-based decision, all of this gets affected. So again, it's not just the doctor here. You now have like a whole system of paramedicals who are supporting the doctor. So again, it's good in a way that you have these paramedicals now being able to do a lot more, but then their ability to perceive certain things are much lower than that of a doctor. So when you put these paramedicals in the way of patient care, so the patient wants to go through this before they can go to, for example, a specialist, this paramedical again becomes the limiting factor on what standard of care a patient gets, and that may usually not be the best that the doctor would do. Like, this includes like not referring somebody when it's really required, not identifying a condition early, and like letting it go over for a very long time. And we had like really bad instances where they didn't really recognize a malignancy, and patients just like dying because of late diagnosis, because of the waiting list being too long, and just all of these inefficiencies, right? So again, like, all of this comes at the cost of the taxpayers' money. So the taxpayers pay this out of their pocket, and it's like a huge tax margin that they have to pay. And all of this money goes to the government. They have this specific allocated percentage that people have to pay for their healthcare. But then that money is not being put to the best possible use like it would be in a capitalistic market, where if you have a disease, you are able to spend on what you want, and you choose what you need based on your money, right? Like, you are able to vote based on money. So that's not the case. And again, like, looking at this system, you have a lot of waiting time. You have these doctors who are, some of these paramedicals and some of these GPs usually block access to the specialists, because they want to protect the system from being overloaded in a real sense. And that limitation is because the committee then has to decide how much money is actually allocated, and within the system there are no competitive forces at play to actually force them to innovate and make things become cheaper or do it more efficiently. So there are no such forces. So people work at their own pace. Not many people take responsibility for actually going out and trying to bring the cost of certain things down. And it's almost as if this system, this system is almost as if it exists in its own isolated world from everything. So they don't think about how much it's going to cost. They just like allocate resources on a first come first serve basis. So once the patient is in, it's great. They're able to treat this patient very well, and they have like allocated beds for this patient, and they're able to do everything possible for a patient. But then they almost behave like all of this is happening in isolation, when it's actually not. Like, you have a lot of people outside the system who are not able to get in, and they still behave like, okay, we are doing our best, we are able to, we are having these discussions about increasing money. Whereas if it was a little bit more competitive, and if they innovated a little bit on the business models, or just how they delivered care, or how certain things were allocated, they could bring the price of everything down, and they would actually, with the same amount of money, they would be able to serve almost all of these people if they acted in a more, in the more capitalistic sense. So that is again like the problem with the government-backed healthcare systems. And again, like most of this is from the Innovator's prescription. I highly suggest this. Do take a look if you find the time. So that's it for this one. Bye-bye.